Are you having trouble getting your knee straight after ACL reconstruction surgery? We're going to go over some of the reasons why you're having trouble and some of the solutions for it. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. All right, guys, before we go into why you can't get your knee straight, we're going to go over why it's important to get your knee straight after ACL reconstruction surgery. So it's very important to get your knee straight after ACL surgery because if you don't get your knee straight, there's several things that are going to happen. One, you're not going to be able to get a full quad contraction because you can't really activate your quad fully unless your knee is fully straight. Just think about whenever you're kicking out your leg, extending your leg, if you don't get that full extension, you won't get that full contraction. So that's going to limit your ability to get your quad as strong as it should be. The other one is it's going to affect your ADLs, your activities of daily living, because if you can't get your knee straight, you can't walk properly. Whenever we're walking, there is a point that it's called the stance space when you're balancing on one leg and then the other leg goes forward, that the knee needs to be straight. If the knee's not straight, then you're going to be always walking with a slight limp. It might not be noticeable, but it's always going to have that slight little limp and it's going to affect the way you're walking. Also, if you can't get your knee straight, what happens is if you don't get it straight early on, you start having some patellofemoral issues, pain around the kneecap because your knee's always slightly bent. It's going to be irritating that kneecap. So we want to really get that knee as straight as we can, potentially as straight as the other leg or as close as it is, but we definitely want to get some hyperextension because it's going to allow you to get your walking back to normal, then progress you to running, jumping, and then getting that quad as strong as you can. Now that you know why it's important to get your knee straight, we're going to go over why you're having trouble getting the knee straight. So we're going to break it up into 3 different topics or subdivisions. So 1 is going to be more joint related, 2 more muscle related, and 3 more neuromuscular guarding. So the first one is joint related. So a lot of people have trouble getting their knee straight early on because of swelling. So that's why you really gotta control the swelling, because when there's too much swelling, it's really gonna have a hard impact on your knee in order for you to get you that hyperextension or that knee being able to get straight. So that's why we really wanna limit that swelling. So using compression, slight movement, whatever you need to do to get the swelling down, which is gonna allow decreased pressure in the knee joint, that's gonna allow you to really get that knee straight there. Now that the swelling is out of the way, another thing that affects the joint is the posterior capsule. So if you think about the knee, this is your knee joint. Here's your anterior capsule, here's your posterior capsule. If there's limitations here in the posterior capsule, you're not gonna be able to really extend that knee. So really stretching out that posterior capsule with long duration hold stretches to really release that, to allow the joint to go down and get that full extension. So that's something that we commonly see. So those are the first 2 joint issues, like I mentioned, the swelling and the posterior capsule. The next subdivision are muscles, so muscular restrictions. So when we think about getting the knee straight, there's 2 main muscles that we gotta make sure their lengths are appropriately stretched in order for the knee to get really straight. One is the calf muscle, specifically the gastroc muscle, because that attaches slightly above the knee, and the hamstring, the muscle here in the back of your thigh. Those 2 muscles play a huge role in your ability to get your knee straight, because if the calf is too tight, it's going to force the knee to bend a little bit. Same thing with the hamstring. If the hamstring's too tight, it attaches below the knee and it starts here towards your butt. That's going to pull the knee bent a little bit. So those are the 2 muscles that you really got to work on getting stretched out, have them relax. That way you get the knee to be really straight there. The last division is more that neuromuscular component. So the first thing we commonly see is that the quad does not have that ability to fire. So people have inhibition, they just have trouble firing that quad. So if you get your knee straight, but if your quad can't fire, that's not gonna allow you to maintain your knee straight. So you wanna make sure you get the ability to fire the quad. So a lot of tools to help address that are neuromuscular electrical stimulation, where we put those electrical stimulation in your quad to really fire it up, and that's gonna help get the knee straight. But really trying to get that quad to activate, wake up, that's really gonna help out getting the knee straight. Another thing is having issues with the tibial nerve. So with the tibial nerve, when we have issues there, that's gonna be really affecting our ability to get our knees straight And a lot of people do it at secondary from the surgery or restrictions from that. So that's another thing you want to take a look at. The last one for neuromuscular division is pain. So pain is a very big thing. So if there's pain or just fear avoidance, it's gonna limit your ability to get your knee straight. So the pain, especially with the patello-autograft, which people have pain on top of the kneecap a lot, or sometimes with the quad, but we see it mostly with the patellar tendon. They have trouble trying to even stretch out their knee because it hurts so much. So that's why we tell them really help calm your pain down by using ice when you're stretching out your knee, getting it straight. But that's a very big factor in getting your ability to get your knee straight. Another one, as we kind of mentioned, is the fear avoidance. So a lot of people are worried that if they get their knee straight, it'll hyperextend, it'll buckle. But in reality, that's not going to happen. You really need to just make sure, trust the process, and really slowly get that knee as straight as you can, step by step. All right, guys, that was kind of a big little summary of all the things that factor in not getting your knee straight. So I'll kind of go over it again. Your joint, first look at the joint, find out if that swelling is limiting it. Also that posterior capsule. When we come to muscle, you got to really stretch out those hamstring calf muscles. When it comes to neuromuscular, we got to rule out any nerve injury, tibial nerve. We also want to really get that quad firing, make sure it's not inhibited. And also we got to look at pain and fear avoidance. If all these things, you addressed all these and you still can't get your knee straight, another thing, and this is kind of like the last case scenario, we've seen it several times as well, it's a cyclops lesion. That's when you really try to stretch out your knee. It hurts a lot when you try to get that posterior capsule stretch. Instead of getting the stretch in the back of the knee, you feel it more in the front of the knee and it's very irritated. And also when you stretch out your knee, then it slowly just ramps back up and never sticks. You may be dealing with a cyclops lesion. I won't go into detail, but that's something you would discuss with your surgeon, and they would get an MRI to rule that out and potentially get surgery to remove that lesion, preventing you from getting your knee straight. If you're dealing with any ACL injuries or you're having trouble getting your knee straight, send us an email. We work with people online and also in person in Los Angeles to try to get their knee straight and try to get back to sport following ACL reconstruction surgery. Also, if you like this video, hit the share button, share it with friends and family, like this video. And also, if you guys have any other questions specifically to the videos that we talked about or the divisions, just comment below and we'll try to answer them as much as we can. We are the Basketball Doctors. Let's ball for life.